This is a technique video for a non-surgical thread lift using 10 of the meant 43 centimeter U-shaped threads. There are 8 threads in the face. There's actually one more mark in the posterior jowls and 2 threads in her neck, as there's a lot of neck skin that's loose. I inject 100 cc's of 0.5% lidocaine with 1 to 200,000 epinephrine subcutaneously into the entire face as a tumescent anesthesia, and I inch my way down. I inject another 30 cc's of the same local for the neck. Then a Hibit cleanse prep, followed by a head drape to keep the hair out of the way and keep the threads clean. I then make 4 1.5 millimeter punch incisions. I apply some Tegaderm, put some holes in the Tegaderm so I can find my holes that I created, and this helps keep the hair down and out of the wound. I then put the temporal needle passer very superficially, and then you thread them just an inch and you pull back on the passer, and then these threads are in there, 2 threads into each of the holes, and then you pass this blunt cannula through in the deep subcutaneous space, pull it back, and you allow the sharp cannula to exit the skin. You thread the needle, and then you pull out the sharp cannula, then you pull the threads taut. The top one is always crossed so you don't get too close to the orbital rim. You have to pull all the hair out of the 4 holes. If you braid this hair, it won't get in there that much. And then you pull on the threads while you palm the tissue up, then you cut these threads as short as you can, or they will show up when they smile later. I repeat the procedure on the other side. I always add a little more local into the temporal area. Sometimes the Tegaderm makes it a little hard to see. I end up doing it without it, but then the hair gets into the wound. So if you had this temporal hair braided with little cornrows right here, it wouldn't have been getting into the wound, but here it actually does. And you're finding that when large amounts of hair do get in there, when you try and pull it out, you end up cutting the thread to get them out. Had this hair been braided, this would have been avoided. When you end up pulling out the broken threads, and then you end up putting another one, and then you have to put another hole, in this case 2 holes up above, because otherwise the temporal passer may cut the previous threads, but then you save it by doing that. You pull all 8 threads through, you pull, you massage it up, you cut the extra threads, just as before on the other side. And then you do the neck. It's not shown well here, but it was the meant 43 centimeters. That was the pass of it. Right after, it's very swollen. This way you don't bruise, it doesn't hurt. Here you see 2 days later, other than a little bit of dimpling, and that she's a little swollen and pulled up. She actually looks pretty good. I'm going to show you how to release that dimple. All you do is you go in the path of the thread, you push right along it and pop. You feel it, she hears it, and that's released as you see there. This is the method for that neck thread that wasn't shown in the video. You make 2 1.5 millimeter incisions along the posterior superior border of the sternocleidomastoid muscle, and then you're actually going to take the temporal passer and pass it through those 2 1.5 millimeter punch incisions. And you got to do this temporal passer very superficially. You don't want to pass it through the nerve that innervates behind the ear. Then you thread the temporal passer just 1 inch. You pull back the temporal passer, pulls the thread through, and you put it even. And then you go parallel to the jawline. You got to go over the muscle, and then you just go subcutaneous. You come out the midline, right where the neck starts to hang. Then you pull out the blunt cannula, thread the sharp cannula, pull out the sharp cannula, and then pull the thread, this time not so tight though. And you repeat it for the second one. It's about 2 centimeters inferior to it, and you come at least 2 centimeters posterior in the midline again. You thread that one as well. And once again, do not pull these threads too tight. This is the path of them. When you pull them too tight, it ends up wrinkling up so much around the sternocleidomastoid muscle, and these are a little harder to release. It seems to catch really well there. This is basically the path of these threads there. It pulls it up beautifully, and here you're seeing 2 days later how wonderfully it does pull it up. There's a little swelling for the first week. I see them repeatedly during the first week just to make sure things are nice and smooth, dimple free, and then I add some filler at the end.